Allen podcast. I'm excited to welcome the program Royal Doc Alan Lindemann. Doc, what's going on, man? How are you?
We're doing really well here, Neil. And you?
I'm doing fantastic. Today's topic is Placenta Accreta.
Yes.
What is Placenta Accreta?
Well, there are several kinds of it, but basically it involves a placenta that is abnormally stuck on the mother's uterus. It's hard to get it off. If you try to get it off, there's a lot of bleeding. So you don't want a placenta accreta, and thank goodness in my 6,000 deliveries, I haven't had one. Lucky for me, lucky for my patients.
How common is Placenta Accreta?
Well, years ago, we used to say it was 1 in about 1,250. Today, it's about 1 out of 272 based on what study you're looking at.
Why is the frequency of Placenta Accreta increasing?
Well, the most common explanation, Neil, is that we have an increasing rate of cesarean sections. For example, they say with the first C-section, you have an 11%. With the second C-section, you have a 40% chance of having accreta. With the third, you have a 61%. And with the fourth C-section, you have a 67%. So there's an association between cesarean sections and placenta previa, but also the amount of pregnancies you have makes a difference. That is, the more you have, the more likely you are to have an accreta. Any kind of uterine procedure and in vitro fertilization seems to be a problem.
What is the treatment for Placenta Accreta?
Well, it depends on how stuck the placenta is, but most of the time, I think that you'd be looking at what we call a cesarean hysterectomy. In other words, a hysterectomy at the time of cesarean section. And that's not terribly complicated. However, it does leave the mother without a uterus. And of course, if she wants future pregnancies, it would be by surrogate.
Can Placenta Accreta be diagnosed before delivery?
Well, we'd like to think that it's possible. I think one of the problems we have is that early ultrasounds, like say 10 weeks, probably wouldn't show. When you get more advanced in pregnancy, for example, 20 or 30 weeks, it would be more likely to show. But since we have this correlation between cesarean sections and placenta previa and accreta, we kind of have a group. We know what group to look for, and we know what to look for when we do the ultrasound.
All right. The best place to go is worlddocallen.com and pick up Pregnancy Your Way today. Available on Amazon. Make sure you go to Amazon now. Take care, Doc.
Thank you, Neil.
That was the Royal Doc Allen podcast, guys. Take